Hi, my name is Dr. Svan Hilo. I'm the head of male infertility at the Mayo Clinic in Rochester, Minnesota. In the following Men's Health Moment, I'll discuss testicular sperm extraction procedures, which are done for men who have no sperm or low sperm counts on semen analysis. I hope that you'll find the following video useful. Testicular sperm extraction, sometimes referred to as TESE for short, is a procedure that's done to get sperm directly from the testicle. Reasons that a man may need to have a TESE done include the following: a history of vasectomy, no sperm seen on semen analysis, a condition referred to as azoospermia, which is due to a blockage of the vas deferens, that tube that carries sperm directly from the testicle to the penis, or because the testicles are not producing normal amounts of sperm. Lastly, couples undergoing in vitro fertilization may elect to proceed with TESE if they have had a failure due to poor sperm quality. TESE is a 15-minute procedure. It's typically performed in the office using numbing medication and the option of nitrous gas, which is the medication you get at the dentist's office that helps relax you. For patients who are extremely anxious, they can choose to have it done in the operating room under general anesthesia, but the vast majority of patients will choose to have it done in the office. Regardless, it's an outpatient procedure, and you can plan on going home the same day. Essentially, what we're doing during a TESE is performing a biopsy of the testicle, or removing a small amount of tissue that can then be used for in vitro fertilization. Please keep in mind that the amount of tissue we're removing is not enough for intrauterine insemination, which requires a much higher concentration of sperm. Success rates vary widely depending on what the cause of your infertility is. Your surgeon can give you a much more precise estimate at your consultation. Microsurgical testicular sperm extraction, sometimes referred to as MicroTESE for short, is a specialized kind of TESE. This procedure is done if you have no sperm on semen analysis due to a problem with the testicles making sperm. It's done with an operating microscope where we open up the testicle and look for pockets of sperm production. It's sort of like looking for a needle in a haystack. This kind of procedure can take up to 3 hours to perform. It can be performed in the office with the same numbing medication and a light sedation, or in the operating room under general anesthesia. Regardless, you can plan on going home the same day, and any sperm that we do find will need to be used for in vitro fertilization. Success rates for MicroTESE also vary widely, from 20 to 60%, depending on some of the factors that we discuss at your consultation. During a MicroTESE, as we're looking with the operating microscope for pockets of sperm production, we'll then sample those areas and look at them underneath a bench microscope to see if there's any sperm. And we'll continue this process for a prolonged period of time or until we are able to find sperm. If we're unable to find any sperm on one side, we'll typically go to the other side as well to see if we can find sperm there. Risks of both TESE and MicroTESE are rare. Complications occur less than 5% of the time, but may include any of the following: an infection of the testicle or the incision, bleeding that can lead to prolonged bruising and swelling of the scrotum, chronic pain of the testicle, a decrease in testosterone production, a decrease in the size of the testicle, and lastly, a disruption in blood flow to the testicle. If this occurs, it's likely to affect sperm and/or testosterone production for the future. Here's a comparison of TESE and MicroTESE. TESE is indicated in men who have a history of vasectomy, who have failed in vitro fertilization due to poor ejaculated sperm quality, and can be considered in men who have no sperm on semen analysis, referred to as azoospermia. It's less invasive and less expensive than MicroTESE. MicroTESE is indicated specifically for men who have no sperm on semen analysis due to poor sperm production, a condition referred to as non-obstructive azoospermia. This is different than men who have a blockage and don't have sperm on semen analysis. That condition is referred to as obstructive azoospermia. MicroTESE is a more invasive procedure, and there's a higher risk of disrupting blood flow to the testicle. It's typically more expensive, although because we're able to perform it in the office setting, is more comparable in terms of expense to TESE. And research has shown that we're 1.5 times more likely to find sperm in men with non-obstructive azoospermia compared to TESE. Recovery after the procedure is the same regardless of which procedure you undergo. We'll have results for you available within 24 hours and be able to let you know whether or not we are able to find sperm. All the skin sutures are dissolvable, so you won't need to return to have anything removed. You can remove your dressing within 24 hours and resume showering, and most men can get back to work within 24 hours. We would ask that you avoid any heavy lifting greater than 10 pounds or strenuous physical activity for at least 2 weeks. And you should be okay to resume intercourse within a week. Thank you so much for watching this Mayo Clinic Men's Health Moment on testicular sperm extraction procedures. I hope that you found this video useful. If you'd like to make an appointment to be seen for male infertility or testicular sperm extraction procedures, you can reach us at the number below on your screen or go to mayoclinic.org. Thank you.